afternoon, friends. Meeting after a gap of 3-4 days, in fact, rather a week. Today, I want to share again one small remedy. In fact, this is a common remedy in our day-to-day practice, but we know that remedy only for the purpose of cough because we learn the mathematics for cough only. But I want to share two cases for which I have utilized it successfully. The first case, which was there of a young lady who was around 20 to 23 years of age, came to me with typical goiter and difficulty in digestion, difficulty in deglutition. And it was a simple goiter. Her USG was done. She was posted for the operation, but she refused because she was not married and she doesn't want to do surgery. So they came to me for the purpose of prevention of the goiter, a prevention of the surgery. I took her case. There were two, three important things which I have observed. She had this problem associated with little bit cough or little bit breathlessness over there. And that breathlessness sensation, she used to explain that I get whenever I get suffocation, I generally get a typical a feeling that as if I'm breathing through a sponge. This is the sentence which she has used. So basically, she was quite weak. So I have done her investigations along with the sonography of the thyroid. I have done T3, T4, TSH level, but they were normal. But she had a goiter typically. So goiter associated with very typical enlargement of the thyroid associated with breathless sensation with a suffocating cough and breathing as through a sponge. These features were very characteristic, and she was quite young enough. So I have started her on Spongia 30 in a repeated doses. In fact, I have given Spongia 30 for nearly about a month, and I have asked her to meet me after a month. When she returned after a month, there was definitely a substantial reduction in the size of the goiter. That was the first case, in fact, where I have utilized Spongia for the goiter, and specifically it was a simple goiter. And thereafter, I have used this remedy number of times with successful results. But what I observed that simple goiter always responds to the Spongia. Nodular goiters, you have to take the help of the other remedies because nodular goiters there are number of times, number of chances of the mixed presentations, and they requires other remedies also. So that case, I have continued nearly about 6 months, and thereafter I have raised the potency 200 whenever needed, and she recovered completely. And after that, I have utilized the tuberculinum as an intercurrent, and thereafter she recovered. The generally, whenever glandular affections are there, the tubercular miasm is dominant. And when you get a typical weak, emaciated patients losing flesh while eating well, the tubercular miasm is definitely a dominating thing. So you have to remove the miasmatic focus. So she got married and have an issue immediately after marriage. She got conceived. Everything was found to be a very normal after spongia. So that was a good case to be shared with you. Second case was a typical young boy who was brought to me with valvular insufficiency, and that boy was having a cough. It looks like that he, as if his cough was right from the chest, but whenever auscultated, the chest was quite good, but whatever is there, that is right from the throat, it was there. It was like a crow, and that crop is associated with the cervical lymphadenopathy over there. And he was coughing. When he was coughing, it was very difficult to listen back because the cough of spongia is a very difficult raw sensation, and whenever someone coughs and it shrills your ears, or that shrill sound disturbs your ear, that is definitely a spongia. So that cup, I have observed that, and I have listened that cup, and I consider this is the spongia, this is crowd which is there. There are pharyngeal, laryngeal affections, and that laryngeal affections generally associated with this typical cup, barking cup. The typical word which is used over there is barking. So if it is there, it always used to be a spongia and response to spongia. If it is associated with glandular affections, never forget the spongia. So I have prescribed the spongia, again in low potency, because susceptibility was quite good enough, not so high, not so low. So I started with spongia 30, repeated doses for a week, and the cough vanished. So this is very important thing one must consider, and this remedy is one of the important remedy in the heart problems. For the valvular insufficiencies or valvular heart troubles, you should not forget the spongia. I have continued spongia later on. Here I have utilized intercurrent remedy as a nausea, and patient recovered very nicely thereafter. So these are the cases which I want to share with you regarding this remedy. Let us go what Allen says about the spongia. So spongia is a remedy from the animal kingdom. So let us see what he says about the spongia. It is a roasted spongia for the tubercular diathesis. See, it is given in italics, tubercular diathesis. So miasmatic focus is definitely a tubercular. It is not a superficially acting remedy. It is a very deep acting remedy. So tubercular diathesis, the constitution is also tubercular. It is weak, not a big bellied or like that. It is typically weak, specially adapted to diseases of children and women with light hair, lax fiber, and fair complexion. This remedy is very close to the bromium. Bromium has typical features like the spongia, a typical curve which is there in bromium, but in bromium, rattling is more. In bromium, it is not a dry cup like spongia. In bromium, more cup is typical of the uh, characteristically the cup is rattling like antimutant. So this, especially in the children, in the woman, lacks hair fiber, hair complexion, this remedy works better. Swelling and induration of the glands, the goiter, and this is very specific for goiter. So whenever you get a thyroid enlargement and if it is simple goiter, think of the spongia. Awakens in a fright and feels as if suffocating, as if he had breath through a sponge. And this sentence is always explained by the peoples. Whenever they are explaining their cup, they used to explain this very commonly. Every mental excitement aggravates or increases the curve. So Lascites mental excitement is there and curve gets aggravated. Curve is aggravated because of slight things. That is very typical with the spongy. Curve worse after the sleep or slips into aggravation like lachesis. Yes, it is quite common with the lachesis. You get this feature in lachesis. They used to get aggravation whenever they sleep. The similar feature here, it is cough which gets aggravated after the sleep. Sore throats aggravated after eating sweet things. So sore throat associated or whenever aggravated because of eating sweet things, never forget about this remedy. Thyroid gland swollen, even with gin, with suffocative paroxysms at night, a goiter. And this is what I have explained with the case. Great dryness of the mucous membranes of air passages, the throat, the larynx, the trachea, the bronchi, dry as a horn. And this dryness is characteristic with the spongia. Same is true with the drosera also. Both are very close to each other. Both are of a tubercular diathesis. Both have a typical curve right from the throat. But spongia has that typical the sponginess which is there in the breathing and that breathlessness, and this remedy basically associated more with the throat, more with the thyroid. Drosera is more with the lungs. Drosera is more with the tubercular patches in the lungs, tubercular affections in the bones. So those are the things with which you can differentiate the remedy. Cough is dry, barking, croupy, rasping, ringing, wheezing, whistling. Everything is perfectly dry, no mucus ralls. So absolute dryness is the characteristic, and that's why it is very hard to listen the sound of a spongia cough. You yourself feels disturbed because of that sound. That is very typical with the spongia. Cup is dry, sibilant, like a saw driven through a pine board, aggravated by sweets, aggravated by cold drinks, smoking, lying with the head low, dry cold winds, aggravated by reading, aggravated by singing, aggravated by talking, aggravated by swallowing, ameliorated of treating or drinking warm thing. So cold aggravates. In general, whatever you ingest, the cup gets excited. So whether you are drinking, whether you are eating, whether you are talking, whenever there is use of a throat, the cough gets aggravated in this remedy because it is laryngeal. Basically, it is related with the larynx, and larynx becomes raw, and it produces typical barking cough. Croup, croup. Already I have mentioned croup is very typical laryngeal, pharyngeal affections over there, and because of which a dry cough develops. Croup, anxious, wheezing, aggravated during the inspiration. Whenever person inhales, there is a crow, there is a trouble. If it is during exhalation, aconite is the remedy. Yes, it is given. The aggravated during expiration, aconite is there. Aggravated before midnight, the remedy is spongia, and if it is up before morning, it is hepar sulfuricum. Hepar and spongia, they are again very close, but in hepar there are secretions which are there. In fact, and it is also one of the important remedy whenever there is a rattling cough. Spongia is completely a dry cough. See the palpitation, heart complaints very important. Violent palpitation with pain and gasping respiration. Awakened suddenly after midnight with suffocation and great anxiety. There is volular insufficiency before or during menses. Palpitation before or during menses. This remedy is an important remedy which acts specifically on the heart, producing heart affections. Functional symptoms of the heart are quite common, but also the structural damage is also there in this remedy. So one should not forget the spongia in heart complaints. Generally, what happens, we remain fixed with the remedies, spongia, cup remedy, drosera, cup remedy. These are the thoughts which are created early in the our learning of materia medica, and those remains fixed. So we have to understand all those things. Angina pectoris. See, this is very important remedy for this. Angina pectoris, the contracting pain, heat, faintness, suffocation, anxiety, and sweat aggravated after midnight. So it aggravated after midnight. After midnight, this remedy plays very vital role. Whether it is breathlessness problem, whether it is palpitation, whether it is heart affection, whether it is goiter causing a constriction over there, everywhere you will get this modality quite commonly. Then again, see the it is also having action on testicles. The spermatic cord swollen, painful. Testicles are swollen, bruised, squeezed after suppressed gonorrhea or maltreated orchitis. So this is a remedy for orchitis. Very important. Generally, if it is a tubercular orchitis, think about this remedy. One remedy where we have discussed the action on testicles was the rhododendron, but there was a hydrocele which was quite common with the rhododendron. This remedy, it is very specifically the testicular inflammation, orchitis, and this testicular inflammation is after suppressed gonorrhea. So psychotubercular miasm is quite commonly comes in this remedy. See the relations. Spongia follows well after aconite and hepar in cough and crow when dryness prevails. So if there is a dryness more after an aconite fails or if hepar fails, think about the spongia. This is a good remedy. After spongia, hepar, when mucus commences to rattle. So if you have given spongia and patient started getting the mucus secretions over there, he says that you use the hepar after the spongia. These are the practical hints. One should read and one should understand them so that you can use very commonly in your day-to-day practice. Compare the arnica, the causticum, iodum, lachesis, nux moschata. Sputum loosened, but much must be swallowed again. In these remedies, this is quite common feature that there is loose sputum in the throat and must be swallowed. In spongia, there is no sputum. In spongia, there is absolute dryness. So all those remedies which he has mentioned over there have that typical feature. So spongia, very good remedy for thyroid disorders. Basically, when it is a goiter, when there is a valvular insufficiency, or whenever there are glandular affections. So this remedy is a very important remedy, and one should not forget in day-to-day practice. So thank you, Dr. Pallavi, Dr. Jayesh Sagar sir, Sindhu, then Gillespie. Thanks a lot. We'll meet again whenever time permits. Thanks a lot.